Organic foods, they avoid synthetic chemicals, and they promote eco-friendly farming, right? So we're actually helping the planet by voting with our wallet and buying organic foods. They also may offer higher antioxidants and lower pesticide residues. They support sustainable practices and reduce chemical exposures. Well, glyphosate is a common herbicide in GMO farming and is classified as a probable human carcinogen. Concerns focus on health risks and environmental impact. Choosing organic helps minimize exposure and supports natural farming. How much glyphosate is actually in our bodies? Over 80% of urine samples from U.S. children and adults contain glyphosate, according to the CDC, of 2,310 samples. 1,885 samples had detected levels which scientists call disturbing and concerning. A 2017 study revealed that a 500% rise in glyphosate exposure since Roundup-ready GMO crops were introduced in 1996. So despite the widespread exposure, research on its impact, especially in children, remains limited. The 2020 environmental health study stressed that without standardized data collection, linking glyphosate exposure to disease is nearly impossible. Residents of rural areas in the United States experience higher rates of preventable deaths compared to their urban counterparts. Factors contributing to this disparity include limited access to health care, higher prevalence of certain risk factors, and socioeconomic challenges. That was a report from the CDC. The incidence of certain cancers among younger populations in the U.S. has been increasing. For instance, colorectal cancer rates have risen by 1% to 2% per year since the mid-1990s among individuals under 55. In 2024, it is estimated that there will be more than 2 million new cancer cases in the U.S., Scientific American Cancer Society reports. The burden of age and lifestyle-related disease, such as cardiovascular diseases and neurological disorders, is expected to increase by about 20% through 2040. This projection is attributed to factors like an aging population and lifestyle risk factors, including poor diet, physical inactivity, and obesity, reported by McKinley and Company. These trends underscore the importance of public health interventions aimed at prevention, early detection, and addressing social determinants of health to mitigate the impact of these diseases.